Okay, which of the following structures is most likely affected in this patient? Lateral medulla, medial medulla, lateral pons, medial pons, or midbrain. Okay. A 55-year-old man presents to the emergency department with acute onset of dizziness, difficulty swallowing, and slurred speech. Physical exam reveals nystagmus, ipsilateral facial sensory loss, and contralateral loss of pain and temperature sensation in the body. So, facial sensory loss is a cranial nerve 5 issue, um, which is found in the pons. We've also lost the spinothalamic tract. Um, and then the nystagmus. He's also got like dizziness, difficulty swallowing. Difficulty swallowing could be potentially like a cranial nerve 10 or 11, but I really think this is a cranial nerve 5. So I'm thinking of the pontines. But deciding between medial and lateral is the fun part. Um,
Hmm.
let's see. Um, so pike, the posterior inferior cerebral artery does the, I'm trying to remember this right. I think it does the lateral. I don't know. I don't think it's I think it's medial. I think because the lateral has cranial nerve 7 issues. That's the only reason why I'm picking medial.
Okay, so
It is.
this, yeah, I can't remember these. These I always forget. But apparently it's lateral medullary or medulla, right? Dizziness, difficulty swallowing, slurred speech, nystagmus, facial sensory, right? So that's a trigeminal loss, right? And then pain sensation, right? Wallenberg syndrome is going to be kind of a lesion in your lateral medulla, and usually it's the pica or your vertebral artery. The rest, I mean, these are kind of, you have to kind of memorize it, at least for me, right? I wasn't ever a big neuro guy. These are the ones that I said, I'll miss it if I see an exam. Everyone has their topics where they give up. This was one of them, because they usually only ask maybe one, maybe two questions about these, but I always forgot these. This one, you just have to sit and kind of be like, okay, the lateral pons does this, the medial pons does this, lateral medulla, medial medulla, right? So, um, yeah, kind of difficult personally for me to remember. I'm not sure if you have issues memorizing these either.
I didn't when we did neuro back in November or October, but it's been a long time since then, and I think I'm gonna hit that like tomorrow in first aid.
Gotcha, gotcha,
That's where I was like, I'm still doing the physiology on the neuro and first aid.
gotcha.